incredible. So again, we look at the transition that happens in a ketogenic diet, and we know that especially in somebody like Lachlan, who she's got a busy life, she runs her own business, she's got 2 teenagers, and she cannot afford for her brain to go offline. So we have been dosing her with ketones, and that's the lesson that I'm going to go through tonight, which so they won't be able to see you for just a couple of minutes here, Lachlan, but I'm going to go through a couple of slides here that I think are really helpful. We're going to use the baby's brain as a way to teach. So people talk about how whether or not glucose can go into a baby's brain or not, and or can go into our brains or not, and whether or not our brains can use glucose. That myth should be put to rest. Our brains absolutely can use ketones. I'm going to show you a couple of slides. Let's do this one. I'll come back to that one in just a second. This is just one of the reports that shows here are 2 fuels that go into our brain. You'll see this MC transporter. That does not stand for medium chain triglycerides. It's a transporter that pushes ketones into the brain. Those little blue symbols are for ketones. Here we have the glucose. I call them the glucose guys. They're kind of square, and they are pulled into the brain by a glucose transporter. So you have one that pushes in ketones and one that pulls in transporters. We can actually measure how much these 2 little carriers work at the blood-brain barrier, and how much one is pulling glucose in and how much the other one is pushing ketones in. When you look at brains over time, those areas tend to make a shift. So this is one of the slides that was presented at the Metabolic Health Conference that I was at in California this past month, put on by Dom D'Agostino and his team. I just want to again say that is an amazing science-based conference that helped people like me on the front edge trying to keep up and be as diligent about the science as possible. So this report shows how ketones, when you expose that body to ketones, the longer we put ketones in the circulation, the better the brain preferred to use them. So as we look at the brain ketone uptake along the bottom here, it says brain ketone uptake. And try not to get too excited about these numbers, but the higher this brain ketone uptake went, which was that little carrier over the blood-brain barrier, the lower the uptake was from the glucose team. So you can say, what does that mean? Does that have anything to do with, with my brain? So I just want to show you something. As the more you used these blue little ketones and they pushed into your brain, the less your brain used this glucose transporter. And so that's really what we did with Lachlan, is we did not want her brain to go offline. We wanted her circulation to, if you look over in this blood vessel over on the side, we wanted it to have ketones and to have glucose. With both of them in circulation, her brain started to use these ketones. She hadn't seen those in years. And over these last 6 weeks, her brain now continues to prefer the use of ketones and pushes ketones into her brain over the use of those over the use of glucose. Now, it's not that her brain isn't using glucose, it's that the transporters at the blood-brain barrier are preferring ketones. And we did that by exposing her blood to ketones through that supplement. Here's just another place to show you if you needed some evidence to say, does the brain actually have ketones that are used in it? This is the brain, this is what they call PET scans, looking at the uptake of glucose in these people's brains. The top row is a row that's controlled. They deny having any memory problems. But that middle row is brains that have had mild cognitive impairment, and the bottom row are actually patients with Alzheimer's. So as I look for that patient with Alzheimer's problem, I'll tell you that their ability to use glucose is how they've fueled their brain. And as their brain gets more demented, as their memory gets worse, they need help figuring out how to fuel their brain. When we added ketones to their circulation, much like we did with Lackland, we can see that this image on the right, in the control group, you can see the increased uptake in the green is a higher uptake level. In the mild cognitive impairment, and I'll be quite honest and say that mild cognitive impairment means, oh my, we can see as the physician that they have memory problems, but they do not meet the criteria for Alzheimer's. They're not bad enough for Alzheimer's. And a lot of this has to do with, does their insurance cover the fact that we need to put them in a nursing home? So there's a lot of politics in what this diagnosis is. Let me tell you this. If you have mild cognitive impairment, do not think you're in the safe zone. You are headed for a major memory problem. You need to find a different way to fuel the brain. And I would contend one of those ways is to use, we're going to go back over to Lackland. All right, you're back online, girl. One of those ways to use the ketogenic diet is, and to just use ketones in people who are having memory problems as they age. There's a couple other slides out there that show folks when you need glucose, when your brain needs fuel. Glucose is an easy, almost lazy way to fuel the brain. But if you can add ketones to that brain, we can see several things improve. Not just the memory performance by those folks in that study, but also we see a lot of improvements in mood stability. We see decrease in the inattention, especially in the children with ADHD. One of the psychiatrists out there, I got to really pick her brain and say, I just can't help but see the connection of how many of the youngsters that I get to hear about, and I've got 3 teenagers myself, so I'm very involved in the schools and seeing the overweight problem that we have and how much that also is happening at a time where this ADHD problem is like, that's something everyone has. And as much as that's a real problem, I contend that if we could fuel their brains on ketones, they would do better. And she kind of lit up and said, oh, you have no idea. This is exactly what several of the psychiatrists in our area are doing, is if you want to continue on stimulants, we are, getting patients into a ketogenic diet, encouraging them to use a ketogenic diet for their augmentation of their medication. And we've had so many of them say, I really don't feel like I need the medication anymore. I can't believe how much less I need the medication. And we've been able to really lower the doses of several of those stimulants. It was a very inspiring speech. And if you ever get a chance to go to a lecture by Dr. Eads, she's Harvard trained and she's just got a passion for youth. She has been helping on a campus, college campuses until just recently, where she just has a wealth of experience and education on that developmental brain and how it can struggle when you don't fuel it correctly. So having said that, again, this book doesn't go into all that, but boy, it really does help.
Please subscribe to my channel and don't forget to click the notification bell so you don't miss out on any new videos. Stay tuned.